So finally, but not least, one of the benefits of the pandemic is you work with people as colleagues and friends who perhaps you wouldn't have met. And that goes for colleagues in Wales, Scotland, and Northern Ireland. And it's a huge pleasure today to invite Rob Orford, who is the Chief Scientific Advisor for Health in Wales, to sum up the morning. So, Rob, you're very welcome. Thanks for all that you're doing, and please send us off in style.
Thank you very much. Thank you very much. And it's an absolute pleasure to be here. What an incredible cast of speakers and contributions we've had from colleagues today. I think it's been a real tour de force for the National Core Studies. I'm just so grateful for all the contributions that we had from the top of the shop to the close of play. I think it's been an absolute whirlwind. So congratulations to the organisers on this really excellent event. We've had some rich and diverse contributions, you know, from the superstructure of science to the real intricate details of the National Core Studies, some great reflections from the media and public and frontline clinical research, and then looking forward to embracing the challenges that might be ahead and the future opportunities for research and innovation of the future. So there's so much excellent science within the core studies, and this is a great platform that's really deeply good. So we know that knowledge is power. I think we're showing that the application of new knowledge is powerful, and we have to apply this to prevent and reduce harm. And we've often described the harms associated with COVID, whether that's directly from COVID, the impacts on our NHS and on other conditions, the harms arising from our interventions, our population interventions, the economic harms and the scarring that will follow, and obviously the harms from either existing or new inequalities that have been introduced. So we know a lot. We know a lot more than we did, but there is still much that we need to learn in our response to this current pandemic and future public health challenges, as we've heard, whether that's disease X or climate change or any of the tractable, difficult problems that lay ahead for us. And that's why the things like the National Core Studies and other programs are so important. So as we reflect on our learnings, we have to take these forward with us to reduce harm in the future, to anticipate these problems. And it's likely that the tractable problems, that the risks that we have that could be mitigated from COVID-19 are the same or similar for other things like non-communicable diseases or environmental challenges, or even respiratory viruses of the winter. So we must work together. We must use our new knowledge, whether that's in disease transmission and environmental transmission, pathogen genomics, population level, surveillance, data science, or serology. We really need to apply that science. We know it has to be open. We know it has to be timely. It has to be relevant, and it has to be valuable in providing the right information at the right time for policy colleagues and decision makers. And I think we've shown a week is a long time in science. So we have to prepare, we have to practice, we must work together in trusted partnerships like the National Core Studies to address these important questions with evidence and learn these lessons. So we must work at pace, and we must be able to sustain that pace as we have for the last 16 or 17 months. So we've learned how to create and mobilize new knowledge at a frenetic pace. We've got to keep that in mind as we go forward. Look, this has been tough. It has been tough for so many people. We need to balance this with kindness. We need to be kind to ourselves and others, and we need to be really inclusive, as we've just heard. So I think COVID has demonstrated what we truly care about. We care about our health. We care about others. It's shown science to be important, and it's shown what amazing assets we have in our scientists and the science infrastructure in the UK. So in closing, keep being sciencey, be evidence-based in your thinking, be honest, be open about what you know and what you don't know. Keep pushing the envelope for our understanding and to address these critical problems. Be kind. And lastly, could you fill out your feedback form? Thank you very much.